doctor is in the house, or on the line more accurately, talking arthritis. It affects more than 350 million people worldwide and is a leading cause of disability. We often think about it as being an old person's disease, and yes, that is true, but it does affect so much more than that. But it does mean also that so many of us are going to be getting arthritis the older we get. So let's ask the expert, Dr. Ahmed Yousif, consultant rheumatologist at Adam Vittel Hospital, joining us live on the line. How are you, doctor?
Hello, good afternoon. Thank you for having me today.
Well, thank you for your time. I know you're busy. We've stolen you away from a clinic to answer my questions, most importantly, those coming in on the text line. If you do have any questions about arthritis, treatment, you're more than welcome to get in touch on 4001. Let's go back to basics, Dr. Ahmed. Can you explain to us what happens in the body when you have arthritis? Can you break that down for us?
Yes, sure. Arthritis is a general term. It can be defined as pain and swelling affecting one or more joints. A more specific term we use for joint pain is arthralgia. Surely there are different types of arthritis that we can talk about. Mm-hmm. So generally speaking, arthritis can be divided into a non-inflammatory type, or which can be due to mechanical causes, and there is also inflammatory types, meaning arthritis associated with inflammation.
And what might cause that, Dr. Ahmed, in terms of the inflammation piece?
Well, in the inflammatory type, our immune system attacks the joints, causing inflammation. Okay. So this is basically what happens. In the non-inflammatory type, such as osteoarthritis, or what we can call in layman term wear and tear arthritis, as you know, as we grow older, the cartilage in our joints tend to wear and tear or break down, which can cause loss of joint space and subsequently pain and swelling as well.
Well, you're talking to someone who's got next to no cartilage in her knees, so I am well familiar with that wear and tear. And I think that's exactly it. You know, it's weight gain, it's weight loss, it is, activities, certain types of activities, getting older, and so it goes on. But in terms of the inflammatory type, what do we know about causes there? Who might be prone to that, Dr. Ahmed?
There are a number of risk factors for inflammatory arthritis. For example, family history is one of the most important factors. Sometimes some types of arthritis tend to run in families, such as rheumatoid arthritis, arthritic arthritis, or even osteoarthritis. So if you have one of your parents or siblings affected, you're more likely to be affected with arthritis.
Yeah, I'm blaming my mum fully. Let's talk diagnosis. What are you looking for? What are some of the questions you might ask, or indeed the examinations and scans you might do if someone comes in to your clinic there as a consultant rheumatologist?
So once the patient visits the clinic, we start by taking a thorough history of the problem, including, of course, past medical history, family history, social history, and drug history. We then tend to examine patients' joints and try to feel for any tenderness, swelling, or reduced range of motion, for example. We tend to also request some blood tests, which are also essential for the diagnosis, including inflammatory markers, which can reflect any active inflammation in the joints. Also, we tend to rely on imaging such as X-rays, ultrasound, CTs, or MRI scans. Yeah.
Okay. Let's go to the text line. Dr. Ahmed with us this afternoon from Adam Vittel Hospital. If you've got any questions relating to arthritis, be it yours or someone else's, you are more than welcome to get in touch with us on 4001. That's the SMS. You've got the ARN Play app and, of course, the WhatsApp 204 871 5500. You can be anonymous, and there's no name on the message that came here on the WhatsApp saying, I had a car accident 20 years ago and dislocated my thumb. At the time, the doctor said, because you've injured it, you might develop arthritis later in life there. Is that true? Interesting question. So an accident, an injury, a trauma, can that lead to diagnosis later in life of arthritis?
Surely, yeah, if you develop trauma or damage the joints, you're more likely to develop wear and tear in that joint. So over the years, it can sort of cause wear and tear osteoarthritis as well, yeah.
So yes, short answer. Is there anything that, this listener or indeed anyone listening today who wants to prevent or, prolong their bone health when it comes to osteoarthritis, anything that you can do or change or try, lifestyle factors, supplements, exercises to avoid, Dr. Ahmed?
Yes, as a general advice, keeping a healthy weight and regular exercise are quite important for prevention. Also, staying away from smoking and other unhealthy habits can all help to prevent arthritis. As for supplements like glucosamine, chondroitin, cod liver oil, or turmeric can all help in the prevention and reducing pain associated with arthritis. Also, I can mention calcium and vitamin D, which are essential for a healthy bone and joints as well. Yeah.
Thank you. We are going to stay with Dr. Ahmed speaking to us from Ahmed Vitali, consultant rheumatologist. If you've got any questions for him relating to arthritis, you're more than welcome to get in touch. We're going to be talking about some of the long-term effects, worst-case scenarios, if it goes untreated. And equally, are there any physical activities that perhaps should be avoided? We had a question from Val, who's 49, perimenopausal, having the brain fog, the night sweats, and has an appointment next week about HRT. She has osteoarthritis in her hands and is wondering if HRT could help the pain. Is there any link to the menopause? And Dennis, thank you for your message, sir, saying, I'm 45, have osteoarthritis in my knees. The surgeon is pushing for a partial knee replacement. It feels too soon. MRI shows very little cartilage, but I'm not in pain. Can I do further damage by delaying the surgery? Dennis says, I'm healthy weight and pretty active. Guys, thank you for your messages. If you've got any questions for Dr. Ahmed, get in touch. 4001, the app, the WhatsApp. We're going to go to the text line next.
This content is for informational purposes only and does not intend to substitute professional medical advice, diagnosis or treatment.
More of Afternoons with Helen Farmer is coming up next.
On the UAE's #1 talk radio station, Dubai Eye 103.8.
At Purina, we believe that nothing should stand between you and your cat, not even cat allergens. That's why we've created ProPlan Live Clear Cat Food, a revolutionary discovery that reduces allergens on cat hair in as little as 3 weeks. Outstanding nutrition with the power to change lives. Available now in pet stores, veterinary clinics and online. ProPlan Live Clear by Purina. Every bond is unique. Let's make it closer.
We're following the biggest wins and upsets of the Formula One season with a dedicated feature on off-script extra time.
That's right. Tune in for Inside Track as we bring you all the biggest stories from the paddock to the pit lane.
Big name interviews, insight and opinion each Tuesday after every F1 race, only on Dubai 103.8.
With the Formula One Etihad Airways Abu Dhabi Grand Prix.
DP World is a leading provider of smart logistics solutions, helping trade flow across the globe. Log on to dpworld.ae for more information.
Dubai Food Festival returns for its 10th edition from April 21st to May 7. Learn new skills from top chefs and dine in unique places with foodie experiences. Explore 10 dirham dishes at restaurants across the city. Indulge yourself and dine at new restaurants during Dubai Restaurant Week. And join us at Etissalat by E&Beach Canteen for great bites and retro beach vibes. Visit DubaiFoodFestival.com to find out more.
1 in 3 adults in the UAE is likely to be affected by non-alcoholic fatty liver disease. So King's College Hospital offers the country's first multidisciplinary program to increase patient awareness. Visit kch.ae.
Whether it's OPEC meetings or oil prices, the Business Breakfast takes covering the energy industry very seriously, which is why we've got a special segment every Friday looking at the big stories making headlines and moving markets. That's in association with the World Utilities Congress, only on Dubai Eye 103.8.
Apply for the Rakbank World Credit Card and enjoy up to 10% cashback on your travel and supermarket spends. Free access to 1,000 plus airport lounges, complimentary airport transfers, cinema offers and much more. Visit rakbank.ae/world. Conditions apply.
You're listening to the UAE's #1 talk radio station.
This is Afternoons with Helen Farmer.
On Dubai Eye 103.8.
19 minutes past 2. Helen with you through until 5 o'clock. Don't forget it is Wednesday between 4 and 5. That means one thing only. It's appointment listening for all of you animal lovers. We've got a massive prize for you every single week. You could be winning a hamper of goodies. And hamper sound... It's bigger than a hamper. It's enormous. You'll be getting a 3-month supply of Purina Pro Plan pet food. There's treats in there. There's toys and supplements, all for the breed and even the age of your animal. Now, how can you get your paws on it, I hear you ask? Just by getting in touch. We are talking dog training between 4 and 5 days. So if you've got any question for our expert, we'd love to help you out there. You can send in photos. You can send in stories about your pets. You can tell us how they came into your life. I just want to hear from you. Every single message, whether that is on the SMS, the WhatsApp, or the app, will automatically put you into the draw. And it's on the WhatsApp 04871 5500, where you can send those photos. And I have to say, I absolutely love to see them. Between 4 and 5, it's pets and vets, talking dog training and treating you and your furry friend to a big prize as well. Joining us live on the line is consultant rheumatologist Dr. Ahmed Yousif. He is there at Adam Vital Hospital, and we're talking about arthritis. It does affect more than 350 million people worldwide. And I'd have to say, you probably someone in your family is struggling and suffering. And I wondered, Dr. Ahmed, if you could perhaps tell us some of the red flags that people could be looking out for in their health or that of a loved one that might point to arthritis. Anything that is kind of, and I know you said there's 2 types, but anything that we should be particularly clued into?
Well, symptoms of arthritis can differ with different type of arthritis, of course. For example, in osteoarthritis and due to the loss of joint space, patient can develop pain and reduced range of motion of that joint. In rheumatoid arthritis, for example, patient can experience pain, swelling, and stiffness in multiple joints. Early morning stiffness is quite specific for inflammatory arthritis. So when we're assessing patients, an important question we tend to ask patients is, how do they feel in the morning? Mm-hmm. And they usually tend to describe significant early morning stiffness. So this is one of the things that you could look for. And you should immediately approach a rheumatologist to get assessed and diagnosed. Yeah.
Now, as I said, we've stolen you away from clinic to answer some texts today, so thank you for your time and your expertise. Val has been in touch saying, 49, perimenopausal, brain fog, night sweats. Says, I do have an appointment with a doctor next week about HRT, but I've also been diagnosed with osteoarthritis in my hands, so swollen joints, a bit of aching. Went for an MRI to rule out rheumatoid arthritis, but it is showing there's a small amount of inflammation in both my wrists and knuckles. Could it be menopause related? And could HRT help with the joint pain? Interesting question about that kind of convergence of symptoms there, Dr. Ahmed. What comes to mind upon hearing that message?
Well, my advice is to always approach the rheumatologist for an urgent diagnosis. Surely, HRT can sometimes help with the joint pain, but surely we need to rule out the existence of rheumatoid arthritis in this case. Mm-hmm. So my advice to her is to see a rheumatologist as soon as possible to get the appropriate diagnosis and treatment, in this case. Yeah.
Val, I will send you Dr. Ahmed's details privately, but if anyone does want those details, you can just send me the word doctor. I'd be very happy to send you a link to the website. And let's help out Dennis lastly. Dennis says, hi both, I'm 45, have osteoarthritis in my knees. The surgeon is pushing for a partial knee replacement, but it feels too soon. MRI shows very little cartilage, but I'm not in pain. Can I do further damage by delaying the surgery? I'm a healthy weight and pretty active. 45 is young. Just saying. What would your advice be if Dennis was your patient? I know you haven't seen his MRIs, but little cartilage, but not in any pain, healthy weight, and spring chicken at 45.
Well, yeah, surely first line treatment for osteoarthritis is always to try and manage the patient pain and try and improve the range of movement in the joint. Mm-hmm. So painkillers and physiotherapy are considered first line in this case. So if she's my patient and there is no other existing inflammatory arthritis, I would probably refer her to have some physiotherapy before advising any surgery.
Okay, people do tend to be a little bit knife happy, so always worth a second opinion and maybe even a third, Dennis. I don't know if you can help out this listener, Dr. Ahmed, but you're here and she's on the line, so I'm hoping we can help out. A female listener who says she's got plantar fasciitis, started at the end of last year, going through a lot of tension and emotional trauma. Says, although it feels better on some days, on some it is painful, sometimes take painkillers to manage it, but I worry about taking the medication as I have fatty liver disease. What's the best solution to cure this condition? Now, I don't know a huge amount about plantar fasciitis, but I did have it after I gave birth, and it was agony. Waking up in the morning, putting my foot on the ground.
So it depends on the causative factors, and when we see patients, we try and rule out any existing inflammatory arthritis as well. Yeah. So my advice to her is also to see a rheumatologist and try and get it managed properly. Yeah.
I'm going to reply right now with Dr. Ahmed's details so you can contact directly. There's also some fantastic podiatrists in town who can help with all sorts of different aspects as well, and I can send you a few links there. Dr. Ahmed, thank you so much for your time today. Really do appreciate it, and for taking messages on the fly. You can be found there at Adam Vitale Hospital, consultant rheumatologist, and if you want Dr. Ahmed's details, you can just send me the word doctor and I will send you the link. Wishing you a great day ahead. All the very best to you and the team, sir.